Almost. Hello and good morning, everybody, and welcome back to the Care Plan. This is actually a pretty special episode as it's a part of a mini series that I'm going to be doing with some of the amazing finalists and maybe some other surprise guests from the National Institute on Aging Startup Challenge, which brings together some of the most exciting new ideas in aging and healthcare. So today, I'm super thrilled to be chatting with Dr. Lauren Blake, co-founder of Alstara, about how she and her team are using AI to change the way we discover new drugs for Alzheimer's and beyond. Hey, how are you doing today?
Good, thanks.
Thanks so much for being here. Super excited for this episode and to just chat a little bit.
Absolutely. It's
Heck
going to be
yeah.
super fun and exciting.
Well, y'all already know how it goes. We're going to go ahead and get right into it with our rapid fire questions. So, Dr. Blake, if you could go back to your first day in the lab, what advice would you give yourself about building a biotech startup?
Sometimes life surprises you. I started doing research in the lab at 14, started working at WPI in Worcester at 16. And so I didn't even know what a biotech startup was. Never mind that I would help to build one.
Well, there you go. That's awesome. So you tell yourself, hey, you're going to do some big things out there.
More like just enjoy the ride and the opportunities and mentors that come into your life.
That's really cool. I love it. I love it. All right. Now tell me about one discovery or insight that completely changed about how you think about drug development.
Absolutely. I think when we're in the lab, we're thinking about pipetting, we're on the computers, and for me, what really changed for me is thinking about the importance of the patient journey from their symptoms to their treatment to how they access care. If we build the world's most effective medicine, but no one can access it, did we really build the best medicine possible?
That should be the title of this podcast. That was really, really good. I love it. All right. Now, tell me about the most unusual place you've ever had a scientific idea.
This question makes me laugh. Really nothing too unusual, but I love to go on walks and hikes in order to get unstuck and kind of mull through my ideas and then usually come up with a solution.
I love it. I love it. I feel like for me, I have my most random ideas in the shower, especially at night. Not morning showers, but evening showers exclusively.
I was gonna go with shower, and then I was like, well, we're live. That might push the line. So I'm gonna go with walks.
All right. Now, this one might be a little controversial, but AI and drug discovery, is it overhyped, underrated, or exactly where it should be?
Entirely dependent on how it's being used and what question you're trying to answer.
All right, keeping it diplomatic. I love it. I love it. And my last one for you.
Not just diplomatic, but I think we're going to get into a little bit about how we're thinking about using AI at Alstara. I'm really happy and excited to share that and continue to develop it. And so I think for us, it's not just the diplomatic answer, but we put really a lot of thought into how we're using it.
Yes,
It's not just LLMs take the wheel.
that's amazing. And I think one of my favorite topics to ever discuss is just use cases for AI that you wouldn't think of immediately right off the bat. So I really do love what you guys are doing. And this one's just a little fun one. So if Alstara were a fictional character or superhero, what would its superpower be?
Predicting the future. We're trying to predict the medicines of the future.
I love it. That's awesome. That's a pretty good superpower. I feel like if I had to choose one, it would either be that or teleportation.
Ooh, good. I'm not exactly sure how that would help us make better drugs, but I don't know, maybe like the physics of it or something would help us learn about molecules better.
Maybe. Yeah, just for me personally, I feel like if I could just be like, oh, I'm in Hawaii, just walking on the beach. All right, now I'm back in the office and we're good. Head cleared and we got new ideas cooking on the way.
Oh, I like it. Okay.
So I think me and probably most of our audience is really curious to know what the sort of aha moment was that led you to start this company.
Absolutely. For me, it was really seeing the contrast in the standard of care for fields like oncology versus aging related and particularly brain diseases like Alzheimer's disease. So, for example, when I was growing up, I actually had a friend pass away from childhood leukemia,
I'm so sorry.
and that had not just a deep impact, I think, on this like deep-seated commitment to health and continuing to develop treatments, but if she was alive, if she had been born today with the medicines and the advancements that have been made in oncology, then she would be alive today, and have a much higher probability of living a long, healthy, and happy life.
Mhm.
And so I really see so much, and I'm so inspired by my colleagues in oncology, who have really made it to their mission to
Mm,
develop these just amazing drugs and drug combinations and therapeutic regimens, that that really that help patients. And so for me, it was really about drawing a line in the sand of, okay, how can we bring, some of those outcomes and insights that have led to those great outcomes into fields that have been a little bit neglected, that it's been a little bit harder to get traction in, that are really, really challenging.
absolutely. I mean, NIA, take out your checkbook, start writing the checks because that's pretty awesome. Like I think that is a really beautiful sort of like first of all mission and like reason to start something. And I never really thought about like how bittersweet innovation is because it's of course like heartbreaking to know that this hasn't been around for the other humans that have existed and other people have had to like suffer the consequences of like different diseases and chronic illnesses. But that's the sweet part of innovation is that we're going to continue to get better at this and medicine is going to continue to advance, and that's really it's really wonderful. But yeah, speaking of, I think the name Alstara is really awesome. Is there like a story behind it that captures what the platform does, or how did you come up with that? I know everyone always asks us about Carrie, and I love telling that story. So I figured I'd ask you too.
Absolutely. I think for us, the um, area of the projects that we can work on is much like the constellations are very broad,
Mhm.
but we're also much like constellations are trying to make connections between, between different stars or between different drugs and diseases, and in order to best identify the most, safe and effective drugs for Alzheimer's disease and related symptoms. And so so for us, it was really about, hey, this is a big problem, much like a big sky, but actually we can start to see those connections, between the stars.
Lauren, I've known you for a while and I had no idea. That is so cool. I love that. So the AL stands for Alzheimer's,
The
or like
Um, sure, let's go with that. Let's go with that. We were coming up with it more from the star
yeah,
part,
the
and then sort of,
awesome.
some off the record advice is, if you have a name that is in alphabetical order, a lot of lists and a lot of like website lists will go in alphabetical order,
Yeah,
and so being towards the top can be very, very helpful. So we wanted that, yeah. So wanted that's the star concept, but then also the A. But it
there you
also,
go.
I love that it could that yeah, because we're working in Alzheimer's disease.
Yeah,
It
that's
also,
that's where my mind immediately went to. I was like, first of all, it's like all as in, all, and then, all as in Alzheimer's. And then, it's beautiful. I love it. That's great. So, getting to a little bit more of like the nitty gritty and like the actual science and the AI in action, you work with these like huge biological data sets, sometimes called like omics data. I hope I'm saying that correctly. Um,
yes.
but so can you walk us through like a moment when the data actually surprised you or maybe pointed you to a new therapeutic idea, or maybe just like walk us through how you use this data on a day-to-day basis?
Yeah, absolutely. And kind of referring back to some of the innovation that's happened over our lifetimes and even in our career. I mean, one of the times when I really, really fell in love with human genetics and computational human genetics data has been the use of PCSK9. So that's a genetic mutation that
Mm,
helped us to genetic mutations within that gene
mhm,
actually helped us to better understand heart disease and ultimately helped us to create this whole new class of cholesterol lowering drugs. Um,
yes.
and so this discovery, I think, shows how powerful genetic and genomic data can be to really point us towards the biology that matters for patients. And we're actually living in an amazing time, not just with the innovation in AI and computing, but also in the past 10 years, there's been just massive collaborative efforts to
Mhm.
collect this omics data. So whether that be genetics, genomics or gene expression, proteomics data, which is really
Mhm.
exciting. And so now we have so much of this data collected and stored and being really ready to be mined. And we're really just scratching the surface of how we work with it. And
Wow.
so if you had told me that, hey, you're going to have access 10 years ago, if you had said you're going to have access to 500,000 patients or just genetics from 500,000 people, and you're going to get that for less than 10 grand, I would have said no way. But now that's reality. That's just baseline.
That's
Um,
that's literally a dream come true, huh?
for me, I mean, absolutely. I mean, my initial studies when I was doing work in undergrad, it was actually using census data to understand like proxy or using that as a genetics for proxy or proxy for genetics.
Mhm.
Um, and I thought, I don't know, a couple thousand people, like that was a lot. And
Mhm.
so for me to not only have that, again, I was using it as proxy. I didn't even have the genetic samples. And so now to see
Wow.
that I have access to so many different people and patients, I really am I'm very bullish on the next 10 years.
That's amazing. I mean, it's only up from here. I feel like the growth is like exponential, not even like linear. Like it's like we are like moving at such an incredible pace, and that's why I like having conversations like this, because there's things going on behind closed doors that, like, maybe the average Joe walking the streets isn't necessarily going to know about. So it's really great to learn and hear that so many of these advances are going on, and it's really cool. And for those of us at home, Dr. Blake does have her background is in genetics, right?
Correct.
Yeah,
Yes.
that's what she got her PhD in. So that's a bit of a tidbit right there. So going back into like the AI part of it a little bit,
Yeah.
I know that for me at least, AI can feel a little bit abstract sometimes. Um, but I guess you kind of like talked about this with, how big the data sets are right now. But is there another example where you felt like the AI helped uncover something that you wouldn't have been able to see otherwise?
Absolutely. I think very broadly, AI really helps us to organize
Mhm.
the data and really process it,
Mhm.
and also find really interesting relationships
Mhm.
between drugs and diseases that if you were to look at it let's say visually, it would be very hard to see because of so many of these relationships are so nuanced,
Yes.
but make such an impact. And
Mhm.
so we're really lucky that we have these tools, that we not only have the data, but we also have the tools to be able to analyze and distinguish
Mhm.
these patterns. And I don't think just because there's only so many people on our team, our eyes can only look at so much,
Right.
and can that I think we get tired, whereas
Wow,
AI never gets tired.
wow, that's a great
It will
point.
keep digging and digging and digging and working. Um, and so I don't think that we would have found these patterns
Yeah.
without.
The thing that I love when AI enhances the human brain rather than replaces it. Like when it's like used in conjunction with and allows for processes to be sped up and, for us to be able to like focus on something else while something that's maybe a little bit quote unquote more tedious is being done by the AI. So love to hear that. So, many of us know, and you probably know this too, working with them, neurocognitive diseases are pretty tough to tackle. So maybe to flip it on the more happy side, what's been one of the most exciting or unexpected breakthroughs that you've had in your career and your work so far?
Yeah, for us, it's really been figuring out how to actually wrangle all of this data that is available.
Mhm.
And so what's so interesting is that on the surface, all of this data is public. And
Mhm.
so a lot of times when I'll talk to folks, particularly folks outside of biology, they'll say, well, it's public. So can't you just use it? Just throw it into the AI and get something out? And
Right.
and just because, and I spend a lot of time explaining, just because it's public
Mhm.
does not mean that it's usable.
Mhm.
In the, it and it's available, but
Mhm.
it's not usable.
Mhm.
And so here at Alstara, we've put a ton of work, both human hours and really deep thinking,
Mhm.
but also algorithmically with AI in order to gather, organize, harmonize, and standardize a lot of this data. And I tell folks on my team all the time, I did it this morning in a in a team meeting that we have, that this effort is very hard.
Mhm.
It is, and it is very detailed, and quite frankly, it is not glamorous, right?
Mhm.
People think, oh, again, that the data is out there and it's available, so just put it into the model, it'll be
Yeah.
fine. But um, and because I think it's not glamorous,
Mhm.
really no other pharma company is doing exactly what we're doing on the data front. Uh,
Right.
but at the same time, because because we're putting in this effort now, it is helping to enable some therapeutics related discovery
Mhm.
that we wouldn't have had without all that work upfront and filling in the gaps and putting things together and making sure all the names are correct.
Yeah.
And so again, I'm so fortunate that my team has really embraced this challenge,
That's
because it hasn't been done before. But I think that it's really going to help with understanding, again, these relationships between drugs and diseases, and ultimately taking those learnings and helping us in order to develop better therapies for neurocognitive diseases.
absolutely. Wow, you answer that so well. I really really love it, and just having met you and your team, there couldn't be a better group of people kind of collaborating on this and working together. And you know what? I can't wait to re-record this podcast 5 years down the road and see all the amazing advancements that you guys have made. So Dr. Blake, we have a lot of students who are on our platform, who are interested in careers in research, healthcare, medicine, just things that are, within the health sector. And you've kind of like bopped around a little bit in this sector too. And you've transitioned, I think, really impressively from research to startup leadership. So I guess maybe a piece of advice for the 18 to 22-year-old listening at home. What's been the most memorable challenge or learning curve moment in building your startup?
Absolutely. I think for me, it's really been that people management aspect and
Mhm.
matching people to projects.
Mhm.
There's really, to me, a fine balance between helping people to stretch and
Mhm.
reach their potential versus just throwing them in the deep end without a life jacket.
I love it.
And so some of the advice that I would give for your audience that's pursuing, let's say, internships,
Mhm.
is when you're interviewing them just as much as they're interviewing you. And so really understanding what is the company's philosophy about interns, and how do they think about their interns development, and then also too, how do they support that? And so, for example, at Alstara, we take a very graduated and scaffolded approach. So, for example, our interns will start with a project that has pretty clear milestones, but also very clear steps and learning objectives. And so the goal for that is to really understand, is to get folks comfortable and working with the technology, setting up a lot of time for learning. So a lot of times we have folks that are coming from the data science and AI space that don't necessarily know about as much about the biology or about like omics data side of things. And so that really gives them that kind of structured project really gives them also an opportunity to learn and see where some of their gaps are. But we do set that expectation early that over time, the kind of step-by-step guidance will decrease, and their autonomy over the project, as well as future projects, is expected to increase. And so we've seen that work really successfully, where folks are coming in with some structure, and now seeing some of our interns development. It's been really amazing that they'll come and tell me like, hey, I think after, again, 3-6 months of this approach, of this approach and kind of learning, they're coming to me and saying, hey, I'm noticing this.
I love it. That's so amazing. The thing, and I think that transition to adulthood, a lot of the times is not really even talked about, because you spend your whole life like 12 and then undergrad and then, grad school, being told what to do, sort of being told like, here's the rubric, here is what you're expected to do, and this is what the result is supposed to look like. And I'm going to give you a grade on that and tell you how that is. Whereas in the real world, I feel like a lot of the times we don't take that into consideration. And that means we're not going to play to our people's strengths. So maybe someone is really great at taking direction and advice and needs that hand holding at the beginning and needs to sort of be given those steps in order to thrive and excel. And maybe 3 years down the road, they're going to be writing the rubrics and the plan and the things for the incoming interns. And then someone else may come in and like within a week, they're like, I got this. I am noticing X, Y, and Z. And so I really love that you said that, because a lot of times one of like our interview questions is also like, what motivates you? Like, why are you doing this? Like, what is the reason for this? And then kind of just like getting to where people are at in that level, I feel like really differentiates a true leader. And just, it's great to see that, you guys are kind of embodying that over there too.
We're doing the best that we can. We're definitely not always perfect, but I also think too, a willingness to talk about your mistakes or things that you are wrong about. I mean, there will be times where I'll be that I will talk to my co-founder if there was an issue or I said something that maybe wasn't correct or didn't have the best suggestion. But I also do try to make it a point occasionally in team meetings to say like, I was wrong, and here's how we're going to fix it, or this is like, I don't have all the answers. If I did, trust me, we'd be cranking even faster on making great medicines.
That's beautiful too, because it also allows people to also own up their mistakes and 100%. That it's okay to make these mistakes, as long as you're gonna just get back up the next day and try again.
Absolutely. And I would, and I actually had a conversation with an intern recently about this, I would so much rather that you try something, and honestly, have it be wrong, have it be completely wrong, but your thought process was there, as opposed to just, oh my gosh, I don't know what to do.
Yeah.
But on the flip side of that, for leaders, that also means that if you say, hey, if you make a mistake, it's okay, you then can't come back and yell at them when they try something and it doesn't work.
That's amazing. I mean, that's literally like exactly how it should be, and how I just love it. I feel like I'm like, did you and Neil have a conversation? Because I feel like we talked about this a couple of days ago.
I don't think I was a fly on the wall for that. However, Neil and I did really click when we first met, when we were at the NIA boot camp in Philadelphia. I think we share some similar values on particularly on family,
Yes.
and also commitment to patients. But I also, it sounds like that we may have something in common when we
About
think
you
about
too. I love
the
it.
company and people development.
Well, speaking of the NIA bootcamp and the Startup Challenge as a whole, how has participating in this accelerator shaped the way that you think about taking science from the lab to the real world and like, creating that impact?
Absolutely. The NIA Startup Challenge has been absolutely transformative for Alstara. One of the things that I love about the challenge is that it forces us to really dig deep into
Mm.
the commercial aspects. And we've just had so many lessons and resources from the Science Center and also from the NIA around customer discovery and really thinking about the value that one's company can provide in the marketplace and how you're going to get there. In particular, I'd love to give a huge shout out to our NIA Challenge mentor, Dr. Charles Mobbs, who's been really influential in the development of our business model.
Oh, that's so sweet. I love that. I'm really glad that you're, having as like great and important of an experience as we are, because truly it's such an important program. And I feel like, for again, those of you who also may not know, the NIA is a part of the NIH, the National Institute in Health, and they are, this wonderful federal agency that is focused on aging and our aging population, and has been such a wonderful partner to startups and founders like us, and of course Alstara as well. And again, huge shout outs all the way around. I completely ditto all of your sentiments, and the resource has truly been wonderful. But yeah, I guess maybe looking forward, say fast forward 5 years from now, what do you hope people will say about what Alstara has achieved?
Absolutely. I think similar to many other therapeutics startups, I hope people say that we're really on the course of changing patients' lives with our therapies. But even more important to me is that anyone who does work with us or for us says that we're technically strong, we're smart people who are also very collaborative and kind. And overall, I just want Alstara to be the type of company that people love working for and building medicines at.
Oh, I love that. That's great. You should put that on your, if it's not already, you should put that on your mission statement, because that's really amazing and inspiring. And and maybe if you could, for our audience at home, just maybe explain what therapeutics really means.
The way that we're thinking about it is really the development of drugs and in order to help treat a patient's disease.
That's
I don't
great.
know if there was something specific that you had in mind.
I genuinely, when I started the challenge, I didn't know what that meant. And I was like, oh, therapeutics, like cool. It's like physical therapy or like occupational therapy and like things like that. And it's like not quite, I mean, it can be, but like way broader than that. So I felt like it might be a helpful little add to
Yeah.
that in
Yeah,
there.
I think that the treatment of disease
Yeah.
aspect of it is a really helpful definition, and then you can sort of dig in. I think a lot of the therapeutics companies, let's say through the NIA challenge, are very like molecule and drug focused.
Yes.
But there's definitely a lot of other solutions that can absolutely
Branches
be
as well.
helpful with
Yeah.
that treatment.
I love it. And, we kind of, we kind of talked about this a little bit about, like advice for like internships and things like that for students or early career scientists. But, for those who are dreaming of like entrepreneurship and, wanting to become founders themselves, is there like a mindset shift or a habit that you've personally developed that you think makes a big difference in, the way that you are leading at your company and being an entrepreneur?
Yeah, absolutely. And this is something that I'm certainly not perfect at, still working on. But I think knowing when to focus versus when to be flexible, curious, and exploratory is really a skill. So, for example, there's times where got to just sit down, butts in seats, and focus. Right, working on your undergrad thesis, and sort of other those big deadlines and milestones, big analysis that you need to complete in order for to meet a milestone for a grant or for a contract. But I think there are lots of other times where learning things, maybe in other, not just in other biological science topics, but really much broadly, can be helpful. So for entrepreneurship, I mean, business development, cybersecurity, accounting. You don't have to be an expert in those, but understanding enough, understanding a little bit, and also ideally having friends who are very good at those topics.
Absolutely.
Very, very, very helpful. And so just thinking about my own career.
Mm-hmm.
I mean, I had a lot of roles that were analyst roles, and so right, that's but when you're at a startup, there's so much to do that if you are getting your own analyst work done, and
Right.
hey, the operations person who sits next to you and you have coffee with every day is completely overwhelmed and needs help with some contracts,
Yeah.
then sometimes volunteering, again, get your normal, get your regular work done, but volunteering for that can be very helpful. And again, working at those at different startups and different companies, I feel like I was like able to see a lot and do a lot,
Yeah.
including writing proposals and reviewing contracts. And I'll
Mhm.
let your audience guess what I spend a lot of time doing now at Alstara.
I think that that's, really being a founder sometimes does mean, being sort of a jack of all trades at times, and, putting on different hats, no matter if you know nothing about what putting that hat on means, and you just got to learn right on the spot. So that's something that's definitely, I feel like, uh, I feel like it's tough to kind of like grasp your head around at first, because their whole saying goes jack of all trades, master of none. But that doesn't necessarily have to be the case at all times, because sometimes truly being in a startup environment means just being flexible and doing what is necessary to be done. And I feel like once you and your team are fully in that mindset, that's when the magic really starts to happen.
Absolutely.
um
Everyone's on the boat, rowing in the same direction at the same speed.
there
And
you go.
yeah, that's what
Now,
we're moving.
we do have an audience question that was already answered, but just because it was my favorite question that we I might ask you to answer it again. So the question is, how did you come up with the name Alstara for your startup?
Absolutely. And I think we're going to get a little bit of revisionist history here,
Oh,
because with Nirvana's suggestion about the AL for Alzheimer's, and not just trying to be top of mind by starting with A. I love that part. But then also we really sought a lot of inspiration with the star part, really sought a lot of inspiration from looking at going outside with our kids and looking up at the sky, and seeing just how broad that is. But then also when you start to look at specific stars, and you can see relationships through constellations, and we're hoping to see disease and drug relationships in a similar way in order to continue to develop therapeutics for neurocognitive diseases.
absolutely. And that is so beautiful and said so incredibly when you become a billion-dollar company. I expect a small shout out.
Sounds good. Plus 5 years from now doing this podcast
There
again.
you go. Heck yeah, it's in my calendar. September 6th, 2030. All right, we're gonna do it. But Dr. Blake, it was such a pleasure speaking with you today and learning more about, all the wonderful advancements that you're making. And I actually can't wait to see you in 3 short weeks in Las Vegas at the health conference.
Absolutely, super exciting to see you, your co-founders, and see how awesome your booth is going to be.
Oh, yeah, we can't wait. And for, anyone else who's listening in the audience that's going to be at Health, Dr. Blake and myself and a whole group of other wonderful founders at the NIA booth, exhibiting our products, and would love to say hi to you and get the chance to get to know you better. As always, thanks so much everyone for being here, and I hope you have a lovely, lovely start to the weekend. Bye, guys.
Thanks so much. Have a great rest of the day.